We're so glad you're here with us in this space today. For those who I have not had the chance to meet or interact with, I'm Becky Payne, President and CEO of the Rippel Foundation, and have the high honor and privilege of working with wonderful colleagues, some of whom you'll meet today, and many of you across the country. Whether this is your first time joining us or you've been here with us before, we're so grateful for you taking the time to be a part of what is a growing community of changemakers. At Rippel, we are committed to the relentless pursuit of a future where all people and places can thrive with no exceptions. And we work tirelessly to help catalyze that future along with so many others, including all of you. A couple of years ago, we committed to being even more relentless in untrapping the lessons, tools, and frameworks that we've had the privilege of developing as part of that pursuit. And this webinar series is just one way we try to contribute to the field and to all of you. Today's webinar in particular helps continue the series that explores the real-world applications of our tools. They're grounded in the stories and insights of leaders just like you. And so you're joining a conversation that is rooted in real-world impact, where tools meet action and ideas come to life through the leadership of community change makers across the country. We try to make sure that this is more than just a webinar series. It's a gathering place for those of you working to transform the systems that shape our lives. And no matter what your role is, your experience or starting point, this space is for anyone who is asking bold questions and moving toward meaningful change. So I'm certain all of you are in the right place. Each episode brings forward authentic stories and practical insight because we know the best learning happens when we listen to those who are doing the work. Today is no different. We'll give you an early look at yet another resource. We are thrilled to be launching and unlocking some more of those assets and making them freely available to the field. We're especially excited about this beta version of our new interactive platform. It's a first of its kind tool that begins mapping the conditions for health and well-being in every county in the country. Our dream and hope is to make sure it is more than just data, that it becomes a true storytelling engine. So you're going to hear from communities about how they are planning and already using this platform and the data contained within it, and the tools and resources that this allows you to tap into to help drive decisions, bridge differences, build dialogue and partnerships, and reimagine what's possible in our communities. So with that, I'm going to hand it over to my colleague, Jane Erickson.
Thank you, Becky, for that welcome. And thank you all for taking time at the start of your weeks to be with us. I'm Jane, talking with you from Syracuse, New York, and I lead Rippel's work around measurement, evaluation, and learning. It is wonderful to see so many longtime colleagues and also lots of new faces. As Becky shared, we've built today's session for all of you, whether we've worked together for years or are meeting for the first time. So we encourage everyone to share your thoughts and ask lots of questions in the chat throughout the whole session. And after this call, we'll share our slides and the recording along with a bunch of resources for you to dig deeper into about everything that we're going to talk about today. So in terms of the flow, I'm going to kick us off with a little bit of context about what the Movement to Thrive Together Hub is, why we built it, and how we hope it can make a difference in your work. Then my colleague Erin from IP3, who co-designed this hub with us, is going to give us a live demo of the parts of the hub that are focused on lifting up data about thriving and vital conditions. And then we're going to turn to a conversation with our partners, Elaine Darling from West Virginia and John Chapman from North Central Washington, about how they're using these resources in their communities. And we're really grateful that they've been so willing to partner with us in this work, and also that they're able to take time from their very busy weeks to be with us today. So with that, let's dig in. So the Movement to Thrive Together Hub is a free online resource that offers new ways of measuring equitable place-based system change. as well as stories and a lot of other related resources. We built the hub for anyone who is curious about finding better ways to build thriving, equitable communities, and also for people who are looking for easier ways to track their progress. So whether you work locally or nationally, through a multi-sector partnership or an organization, or you're a resident who wants better understanding of health and well-being in your community, if your goal is building thriving, equitable communities, we hope that there is something for you here. As Becky shared, this is a beta version and it's very open to evolve with input from all of you and others. We'll share more towards the end about how you can get involved if you'd like. But let's start some background about why we built the Movement to Thrive Together Hub with our partners at IP3 and what it's designed to do. So for me and my colleagues at Rippel, the thing that motivates us to show up at work every day is a deeply held belief that we can all thrive together through shared stewardship. We take these 5 words really, really seriously, and we are joining with others all across the country to live into that unifying and measurable expectation. And we know that even with systems that are fraught with the injustices that we see everywhere and the divides that are fracturing how we understand one another, we can transform these systems if enough of us commit to thinking and working in different ways together. That is what we call shared stewardship. So this is what we've devoted our team and our tools to at Rippel for over 15 years. And we've had the privilege of seeing the incredible work that's happening across the country and the real momentum that's growing, the organizations and the partnerships that see themselves as stewards that are helping communities thrive together, which you can see through this map. And at Rippel, we're really committed to understanding what helps these people, all of you on the front lines, to be more impactful and to come together in better ways. It's why we're very focused on developing resources, sharing them widely, making them freely available to really give lift and momentum to the leaders who are striving to build thriving communities. And while we have the honor of seeing a lot of this incredible work, we also know that it's really hard for you all to see each other, especially in these moments of fear and division. And we know that there is so much strength that comes from knowing you're not alone, from being able to see what others are going through, their challenges and progress, and that when you can see how others are doing, it also helps to make sense of your own work and your journey. So this is at the heart of why we built the hub, to really make visible what we have had the gift of witnessing for so many years, with the hope that it will help to lift up your critical work and to help you to move farther faster. So just imagine if all of us had way better system intelligence at our fingertips, signals and resources about the full spectrum of things that we know matter most when working to build thriving communities. Information that helps you figure out where you need to go, how to get there, and that helps you to make the case to others to join you in your work. And intuitively, I think we all do have a pretty good shared sense of what the most important things are in this work, the signals that are most useful. It's about thriving. Who is thriving, struggling, and suffering? It's about vital conditions, understanding whether the things are in place in our communities that are going to help everyone to thrive together, like meaningful work, a thriving natural world, like basic needs for health and safety, and a sense of belonging, and really, really importantly, the civic muscle that we know is so critical for people in communities to build all of these conditions together, especially right now. And then there's shared stewardship, the ways of thinking and acting together that help us to build these vital conditions. So this is really about understanding how well we're collaborating and adapting and building the relationships and trust that we know is so foundational to this work. So we built this hub because we know that these three key ingredients are super important, but we also know that they are being measured now. Gallup is doing important work through their well-being index to measure thriving. IP3 and others have been collating publicly available data about vital conditions for years. And at Rippel and ReThink Health, we've been measuring the state of shared stewardship across the country for almost a decade in nationwide surveys and through assessments in our fieldwork. So we just haven't seen data and resources organized around these key elements in one place that is free and easy to understand until now. Really importantly, the kind of measurement that we're talking about here is not looking at every single dimension of health and well-being, or all of the different social determinants and economic drivers that are involved in the work of building healthy communities. This hub is really built to lift our gaze, to help us look beyond just projects and programs, to help users build an ecosystem perspective about what's changing, what's not, and why. So this is the three-part structure of thriving, vital conditions, and shared stewardship that really underpins all of the resources and the data that you'll find in the hub. And we're really hopeful that this holistic view that all of these pieces allow is going to be helpful for your work. So before we dig into kind of what the particulars are that are in the hub, let's first take the temperature of everyone in our Zoom room and get a sense of how you're feeling about having access to this kind of information. A lot of the people that we've met and talked with have said that this would be helpful for their work, but we want to hear from you. We're just getting going with this, so we value as many perspectives as possible. So my colleague Kamal just opened up a poll. So let us know, how useful would it be for your work to have freely available information about thriving, vital conditions, and shared stewardship? All right, let's see what we have. Come on. So a lot of folks are telling us this is extremely useful, somewhat useful. Some need to learn more. You are in the right spot today. So it's great that we see so many positive responses. And it also matters that we're hearing similar things from people that work in a lot of different ways. We are a motley crew on this call, folks who are working locally, nationally, and in different sectors, public health, healthcare, foundations. And that's been a really big design principle for us in this work. We really want this to be useful for folks who are working in different areas and in very different places in the country. So we know that there is a rising conversation to thrive together, and that's why you all are here, and that you feel this kind of system intelligence would be helpful for your work. Google also tells us that conversations around thriving together are on the rise, and amazingly, there are even rising conversations around shared stewardship. So all of this is good news. And we know that it's not nearly enough. We know that doing this work is way harder than it needs to be, which is why we built the hub, to really lower some of those common barriers. So now I'm going to get into some kind of facets of the hub before I hand it over to my colleague, Erin. So we designed the hub to help users understand, track, and take action in your work. We invite you all to dig around after our time together. And when you do that, you're going to find resources to help you understand the movement to thrive together and why it's important to track thriving, vital conditions, and shared stewardship. You can track and explore measures for vital conditions and thriving by a county level with state and national benchmarks. And we share nationwide trends about the state of shared stewardship across the country. And there's also a lot of resources to help you take action based on what you are learning from all of this data. So stories from local and national stewards and curated tools and resources from community commons. So really quickly, let's do kind of a double click on the data that you can find about thriving in vital conditions. So we've built a national dashboard as well as 3 community spotlights to show what it looks like to translate these measures in different local contexts. The national dashboard is comprised of 25 indicators across the 7 vital conditions, as well as thriving. And we focused on a relatively small number of indicators that we feel are most useful to paint a picture of progress in places across the country. Those indicators also use kind of an asset-based framing, which is a narrative model that really aims to lift up the aspirations of individuals and communities rather than their challenges. So, for example, we've reframed an indicator around food insecurity to simply read food security. So those are the kinds of things that you'll see when you start digging around in the national dashboard. And you can learn more about how we selected the 25 indicators on Rippel's website. So we also have 3 community spotlights from Delaware, West Virginia, and North Central Washington. And in each of these places, you can see measures for vital conditions and thriving across 70 indicators. So a much larger range than is available in the national dashboard. And we've also worked with each of the teams from these communities to share their story of how they've centered vital conditions and thriving in their work, and how that's helped them to strategize and measure and learn and take action in different ways. And we're going to hear more from Elaine and John about that in a second. But really quickly, our long-term vision for the hub, especially for the national dashboard, is to have freely available data across indicators, so the full suite for any geography that matters to you. So right now we have just a slice, and we know we'll be able to do more with investment and partnership from others. So with that, I'm going to hand it over to my colleague Erin from IP3, and then we'll hear from Elaine and John.
Terrific. Thank you, Jane. I am honored to be here today to demonstrate this shared work. As Jane shared, on the Rippel site, you will find the hub. So when you're browsing on the site, you'll go to the Movement to Thrive Together, and that's where you can access the hub and the dashboards that I'm going to show today. So we at IP3 have partnered with the Rippel Foundation to make available those 4 dashboards that Jane previewed. These demonstrate a thriving together lens to data that can help stewards like all of you take meaningful action in your communities and regions. So found here under the hub, you'll find Explore Thriving and Vital Conditions data. And here you'll see a couple of things, again, that Jane previewed. First is a national dashboard, which is available for all counties across the nation, as well as 3 local snapshots from communities that have embraced this framework already to build thriving communities. So let's go take a look at the national dashboard first. So the national dashboard is a focused set of about 25 indicators organized across the 7 vital conditions for health and well-being. What you'll be able to do when you visit this is use the drop-down menu to enter in your county. And for the purposes of this demo, I've selected Cumberland County, New Jersey. What you see beneath that is a view here, a snapshot of how your county is doing across each of these vital conditions relative to either the state or the national benchmark. So here on the right, a red or a green shading indicates whether this county is doing better in green or worse in red than that selected benchmark. And you can change the benchmark here, and you'll see that the scores update accordingly. You can also expand to see what's contributing to these scores. So for example, I will expand the vital condition of belonging and civic muscle, and here you'll see those selected indicators that are contributing to that particular score. You can also choose to expand and see the data broken out by race and ethnicity where possible. And as Jane said, these indicators were selected to favor an asset-based approach where possible. So these 25 indicators are not meant to be exhaustive. They're just a starting point, and we have been able to make them available for every county in the nation, and we're very excited about that. Below this view, you will find a deeper dive into each of the vital conditions as well as long, thriving lives, including some interactive visualizations, including maps, and even bar charts to look at the data broken out by race and ethnicity. At the top of the national dashboard, you'll see the ability to jump down to select an individual vital condition. So let's take a look at lifelong learning. Here you'll see more information, including additional interactive components, including the ability to see the data by census tract within this particular county and hover over to see the values there. You'll also see that comparison to the state and national benchmark, and even some trends over time. You'll also note that for each of the vital conditions, there's an ability to jump over to Community Commons to see additional information for each of those vital conditions, including resources, tools, and stories from across the country. Let's return back to the hub and take a look at these local snapshots. So these communities are using the full suite of indicators, over 70 in total, to inform their action on the ground. Let's start by taking a look at Delaware. So since 2021, Healthy Communities Delaware has used the vital conditions to guide place-based strategies for well-being across the state. As you explore this report, you're going to notice that they have the full suite of indicators rather than that focused set of 25 you saw on the national dashboard. So again, let's take a look at belonging and civic muscle in this dashboard. Notice many more indicators are available. But like before, you can still expand these to see what is available by race and ethnicity and explore the full suite of data across each of the 7 vital conditions. In addition to this full suite of data, you'll see some great examples of how they have incorporated the vital conditions into their state health improvement plan, their state health assessment, and other reports that really show how they've infused this approach as well as stewardship practices into their work to ensure that everyone has the opportunity to thrive in the state. Let's jump over to Washington and take a look at Thriving Together North Central Washington. So Thriving Together North Central Washington is one of 9 accountable communities of health in the state, and they've grown from a Medicaid-focused initiative to a regional network, working toward the goal of all people in all places thriving, no exceptions. The region features 4 counties in the north central part of the state, as well as the Colville Reservation, and they too have been using the vital conditions to create a shared language and a shared purpose across their region. They've been doing this work since 2022, and similar to Delaware, you'll be able to explore nearly 80 measures across the 7 vital conditions for each of the 4 counties and their region as a whole. Users are able to select their geography here at the top from the drop-down, and the data will update. They have also deployed the Wellbeing Survey to capture data around thriving, suffering, and struggling in their community. You can learn more about this work and their survey and explore stories featuring youth, outdoor, and rural perspectives on the page as well. And we're going to get to hear more from John from North Central Washington shortly. So finally, let's head to West Virginia. West Virginia's Wild, Wonderful, and Healthy West Virginia, which is a statewide initiative of the Center for Rural Health Development, has used the vital conditions since about 2021 as their framework for collaboration. Their dashboard covers all counties in the state, and again uses that full suite of indicators. This view has really helped bring together multi-sector partners around a common goal for health and well-being, and has allowed folks to see themselves in this work where perhaps in the past they haven't recognized how they fit in. And we're just so honored to have Elaine and John from West Virginia and John from North Central Washington here today. And we're going to actually turn to them now to hear a little bit more about their stories and how they've used the vital conditions in their work. So it'd be great to turn to you both and hear a little bit more about your story. Maybe John, we can start with you. Why did you decide to use the vital conditions, and how have you used this data infrastructure?
Yeah, thank you, Erin, and welcome everyone this morning. So as Erin kind of alluded, our region is one of the 9 accountable communities of health in the state of Washington, and we actually got a lot of our legs and work going under the state innovation model and 1115 waiver with the Washington State Healthcare Authority and the Centers for Medicaid and Medicare Services. So we started in a healthcare transformation centric focus, and now I would say in a lot of ways we are really focused on improving health and well-being, and our mission is focused on improving health and well-being. And really during COVID was when we were able to make that switch, as everyone was switching that focus and looking at really how do we address some of those urgent needs associated with the pandemic. Our organization was able to spend some time to look at really where can we make the greatest impact and focus on our work in North Central Washington. And some of it was really identifying the fact that we didn't provide direct services, and so we didn't have to pivot in that same way. And we could really look and focus on some of this upstream work and really what's the direction do we want to go as a region to really look long-term improving the health and well-being of our residents. How can we support partners to move more upstream in this work? And so we spent some time, and I see them on this call, partners with community initiatives, looking at the different models. And we also had presentations from a number of the individuals that you saw on that map. And for our region, when we really looked at what is a framework that resonates well with all, what's a framework that really spoke to a number of our partners and sectors, it was really looking at those key vital conditions for health and well-being. We had intersected in frameworks around social determinants of health. And again, that really spoke to our healthcare partners, that really spoke to our public health partners, but then we really struggled engaging with some of our small grassroots organizations. In reality, some of our business partners and how they, and colleges and how they could intersect into this work. But once we switched that framework, we really started to see people coming out of the mold and really understanding. And it was amazing in probably about 2 or 3 months of that switch in our branding switch. We had partners say, oh my gosh, one, you exist. We didn't realize you existed until you changed your name and switched your focus. And two, we know how we participate in this work and where we can be part of this work. And so that switch really started to change our engagement. Today, we still engage healthcare partners, but I would say the bulk of the organizations that we really support in leaning to this work are small nonprofit grassroots organizations, other community coalitions across North Central Washington who are also trying to figure out how this framework works within their organization. And in a lot of ways, our colleges and community partners who have never seen themselves really contributing to health until we really talked about how health is much broader than just healthcare or public health, but really what health and well-being means to our region. I guess I'll leave it at that for now, and I know there'll be other questions that lead into this.
Yeah, absolutely. I know we'll want to dig in a little further. That's great. Elaine, could you answer that question from your perspective?
Sure. Good afternoon. Thank you for inviting me to be here today. Just to give a little bit more information about my organization for the context as to why and how we use the vital conditions. As Erin mentioned, I'm with the Center for Rural Health Development, which is a nonprofit organization that's focused on improving health and strengthening the healthcare delivery system across West Virginia. So we have several programs at the center, including a Rural Health Infrastructure Loan Fund, a statewide immunization coalition, and an Institute for Healthcare Governance. And while those are strong programs, we decided several years ago that we wanted to develop a new program that would get at the root causes of many of the health issues that West Virginians face by creating long-term health improvements across our state. So in 2018, we began developing Wild, Wonderful, and Healthy West Virginia to do just that, create long-term sustainable community health improvements in local communities that would subsequently lead to a healthier workforce and support economic development. Through this program, we work with local cross-sector teams to develop long-term community health improvement plans, or CHIPs. Initially, we had used the social determinants of health to look at the root causes of the health issues in the communities and to determine strategies to integrate into the plans. However, as we began learning about the vital conditions for health and well-being, we eventually switched our discussions from social determinants of health to the vital conditions for health and well-being. We know that much of our health is impacted by the factors that exist outside of the healthcare system. However, oftentimes we find that many of the folks that we work with want to look to the healthcare system to solve health problems. So switching to the vital conditions framework, which offers that clear description of how the conditions in our communities, including those outside of the healthcare system, impact our overall health and well-being, made this concept easier for people to digest. And so once that foundational concept is understood, it's much easier to focus on developing long-term plans to make changes within the community that will improve the vital conditions for health and well-being. And most importantly, it made it easier for the folks on the community teams who were from outside of the healthcare or public health system to understand why it was so important to be involved. In terms of the data infrastructure, we use the data and the dashboard to provide, really to begin the community health needs assessment portion of the community health planning process. Then we also gather additional local data and qualitative information from the community then to help provide a more complete picture of the health issues that our communities are facing. So that's a quick overview of how we're using it so far.
That's terrific. Thank you.
So you all started to talk a little bit about some of the changes that working with the vital conditions and using it to support your kind of strategy and measurement and action is starting to seed in your work, but would love for you all to share a little bit more, some stories to kind of really bring this to life even more. How do you feel like you're able to work differently now than before? And why don't we start with you, Elaine, since you just finished, and then we can go over to John.
Sure. We found that the inclusion of the belonging and civic muscle vital condition has been extremely useful. The data reflected in this condition are not typically included in healthcare and public health related data sets. So with the inclusion of it in the vital conditions framework, it's helped us to ensure that this aspect is included in our discussions as we work with the community teams to develop their CHIPs and to ultimately utilize strategies that will have a positive impact on the community member's sense of belonging and civic muscle.
And for us, what I would say is the data has been really helpful in starting to change the narrative and tell the stories of the way we should be doing this work. And so we've actually continued to use the IP3 data and the vital conditions data to kind of continue to engage community members in how they look and evaluate this work differently. I think the key example is we have a strong partner in a localized coalition here called Our Valley, Our Future. And so they operate out of a different framework, but they looked at how they map their framework to the vital conditions for health and well-being and how we start talking about the different key indicators to start changing the way how community members in that local region look at the data and have these conversations. And so for us, it's been a little bit of more focusing on not starting an analytical component, but how do we start getting the community to talk differently, think about how they're measuring some of this data a little bit differently, get them used to it and give them the opportunity to ask questions around, you know, what's behind this data? What does it look like? How do I utilize this in my organization? And then it kind of turns to, can you share this with the broader network that I operate in?
That's great. So I think really highlighting how the framework and the resources kind of helps to elevate shared values and helps folks who work in kind of different but related areas be using similar language, see how they are kind of contributing to that bigger whole. In your first remarks, John, you spoke a little bit about how the vital conditions framework has helped sectors and organizations that previously wouldn't have necessarily seen themselves in the work to really think about their role and how they can contribute to building healthy communities in some really different ways. And we see a really strong connection between that and this thriving together movement that we've been talking about, which is kind of the hope that the hub is going to really help to galvanize even more action around that. Can you tell a little bit more about how you see all of this kind of helping to build a movement to thrive together in North Central Washington?
Yep, and I'll emphasize to that concept of a movement. To be honest, we've been grappling with that a lot in North Central Washington in general, because I think we're all structured not necessarily to do this work in a movement space, but always in like collective action planning and joint planning processes. And so for us, it's been really tough to say, what does success mean to us? And success doesn't necessarily mean that we are planning or shaping or doing everything that's involved, but we really see a lot of our collective partners engaging in this vital conditions framework and this vital conditions discussion. So even another example, and I'd emphasize this with this, you saw the map of North Central Washington, and even though we're a rural Washington, people don't see us as local, they see us as regional. And so we as a region have to get even more hyper local. So another example is in Okanagan County, there's a Okanagan Coalition for Health Improvement that's been looking at how they utilize the vital conditions framework in this work to identify what they're calling a multi-solver, which again, I have to give community initiatives credit for that. But they've been spending time looking at the data and looking at the vital conditions and figuring out how do they identify something they can do in Okanagan County that will solve different problems across different sectors that's still really focused into this upstream work. And for us, the fact that we're not leading that effort and the fact that one of our community partners that operates another coalition is leaning into that work, that's in my mind a successive movement. It's really spreading the idea and the value of this framework across our region. Like I said, getting people to understand the narrative and the story behind this, and then really letting them take it and run it from there. We don't have to, in some ways, and honestly, we don't have to do the work after that. The work just continues on in the presence and the efforts of another coalition that's leaning into this. And that to me is like that seed or that start of success. And then as they continue to grow and grow that into their community, we'll really see more organizations leaning into this work.
I love that you emphasized the importance of the shared values and the shared language. Knowing that those are the kinds of things that are gonna outlast and help lots of different types of planning and programs and projects. So it really gets at how important it is to kind of build collaborative capacity that helps us to do all this work better, not just through important work around community health improvement plans, but we want, again, to be building tools and resources that help us to do all of it better over time.
Yeah, that's so many great points there. Really appreciate where the conversation has gone so far. I would love to hear, what we can do to continue to support your work in this front. So if you had a magic wand, what infrastructure, what information, what capacities would you need and what would help you kind of continue this? And maybe Elaine, you could answer this one for us.
That's a hard one to answer. I would say, I guess if I had a magic wand, I would like to have the capacity of more time and more staffing. In rural communities, there are often just a handful of folks doing a great deal of work to lift their communities. And so some of our communities some of the counties in West Virginia only have 6,000 or 7,000 people in the entire county. And so that means when, at the local level, a local town or a local county government might only have a few staff members, and then you have maybe a few volunteers as well from other sectors. So implementing policy systems and infrastructure changes can often run into the barriers of having enough people and enough energy for those people and time to see those changes through. So that's generally a pretty sizable barrier that we run into in rural communities that, you know, if I had a magic wand, I would focus on that.
Yeah. John, anything you'd add to that?
You know, for us, I think a lot of the additional support and infrastructure that we could always use is taking the vital conditions data in this framework and always kind of understanding how to infuse it with localized data. You know, we still have a lot of partners out there that do CHIPS and community health needs assessments and that, and so we're always trying to push that framework to understand how they can infuse vital conditions into this work. But we started in some ways with more of the smaller grassroots organizations, and so those traditional partners who still do those traditional health assessments have come with, in some ways, a level of skepticism to ensure that this data and this framework works or meets the needs that they have. And that continual need or support to understand how that this can transition and support the assessments that partners are doing in our region and not take over or replace the great work that they're doing. That's an area we can always use additional support on. And then the other thing I would always emphasize in our region, same thing, a lot of the organizations we're engaging with, they're small nonprofit organizations. So it's the capacity of our partners that sometimes can be the rate limiting step too. You know, you have a lot of people doing great work, but we're all on kind of, you know, on the ends of our capacity and trying to lean into this. And it's those community-led, community-driven organizations we really want to be part of this, not necessarily always the massive larger nonprofits.
We have a question from the chat I'd love to open up to both of you as well. This is from Chris. Have you started working in all the vital conditions, or have you prioritized some ahead of others?
So when we work with the community teams to develop their chips, we encourage them to start by focusing on one particular priority health issue and develop their plans around that first and get their strategies underway and start to see impact in that area before they expand to other areas. Oftentimes there are some things that that of course overlaps several vital conditions, and so we then focus on several of them. I'll give the example of one of the communities that we're working with does not have a grocery store in the entire county. And so that's one of the issues that they want to focus on, is identifying a new model of a community grocery store that would work in a very rural community. However, they also have a significant amount of vacant buildings and dilapidated buildings. And many of those are restricted at this time. So they need to focus on the dilapidated buildings before they can even get to have the space for the facilities for the grocery store and for a community health center, or excuse me, a community center that they also want to create in their community to give opportunities for building that belonging. So they're sort of focusing in the long run on creating that long-term change, but they have to work across several conditions in order to be able to get there. Does that make sense?
Mm-hmm. Yeah, thanks for that. And John, Sarah Bates from your team shared that we're inviting partners from sectors from all of the vital conditions domains to participate in our efforts, but we started with a focus on belonging and civic muscle as a priority, since it touches each of the vital conditions. Is there anything you want to add to that, or?
Yeah, and when we did our well-being survey, you know, belonging and civic muscle also came as one of the top 3 that supported well-being, and honestly one of the top 3 that if it wasn't there, had a negative impact on well-being. And so naturally our region leaned into that work as a whole. We're trying, the best of us is really to educate and infuse the vital conditions into our region, and then let our community and our region identify and kind of self-select in where they want to provide their focus. And so we say a lot, we're trying to create the environment for organizations and partners to really lean into this and then let them take it from there. And so we have even a local food coalition that's looking at expanding more regional wide. And that's not something we drove, but really have kind of emerged out of these conversations. And so we are looking potentially, how do we support that broader growth in space? But we're hoping to really see this emerge bottom up, and then we can provide the capacity or environment for them to really lean into this work more fully.
That's great. We have a few questions. So I'm wondering if both of you can speak a little bit to how your work and the kind of data resources that have been made available through this infrastructure are helping other community coalitions to do their work. So John, you had spoken to that a little bit, and we had a question in the chat, Elaine, around whether there's some smaller West Virginia counties that are kind of maybe teaming up to form alliances, and kind of questions around how these resources are helping folks to collaborate differently, especially more at a grassroots level. So whoever wants to kick us off with that one.
Yeah, so I would say in West Virginia right now, there are some groups that are sort of teaming up regionally for various projects. I wouldn't necessarily say that's specific to Wild, Wonderful, and Healthy West Virginia. What, in terms of the community teams that we work with, there is one team that's made up of 2 small towns that are on 2 separate sides of the river, but they are very close and they've developed a really strong relationship. So they have actually a formal structure that they've created so that they can be able to apply for funding that they wouldn't necessarily be able to access as the individual towns on their own. So they have made that formal change. With our community teams, with the other community teams, they tend to we bring them together frequently to share information as to what strategies are working in their communities, to be able to ask questions of each other and learn and do that peer-to-peer learning. And then we also engage other communities from across West Virginia in our training opportunities that we offer. But so they're open to other communities that may not be involved in Wild, Wonderful, and Healthy West Virginia at this time. So we do look at different ways of partnering to share resources, but it varies quite a bit.
I'll say for us, because I think this is going back to the data question, last fall we actually did a summit where we presented our well-being data and included components of the vital conditions data as well in that. And so at a regional level, we've been able to continue to share that data and what it looks like as a whole as we shift and focus on our region. Some of the local coalitions, just like the example I gave in the past, has used that somewhat as a regional level to enter into conversations around vital conditions in this work. A nice next phase, and I know we've talked to Erin about this before, is sometimes those reports can also be generated at more of a hyper-local level. So those specific coalitions operating in that space can also look at it for their geographic region and start engaging in those conversations. We actually haven't done that yet, but that's an area we offered out there. And we hope at some point as we shift in this conversation, that would be another phase where we're not actually sharing reports, but people are coming and requesting, hey, let me see this at my area here and look at what I can use this information for more specifically. But that's yet to come.
Thank you both. I'll highlight one other question that's come up in the chat. And if anyone has any clarifying questions about the hub itself or any of the kind of juicy details that we dug into today, please plop them in the chat and we can continue also talking with Elaine and John. So we had a great question from Walt about what multi-solving is. And we do a lot. This is kind of really central to how we work and our colleagues at IP3 as well in terms of thinking about making choices and investments that are going to have multiple benefits simultaneously, even if kind of the primary intended goal is more focused. John spoke a little bit about multi-solving, and I'm wondering if you can talk a little bit more about how you all have interpreted that, what that has meant to you. Our colleagues in Delaware, Kate DuPont Phillips have also done a lot of really awesome work around multi-solving, and we can share some resources from them afterwards and welcome those colleagues to jump into the chat as well. But John, why don't you speak a little bit more about multi-solving?
I'm not sure I need to give credit to the term to. So whoever out there, this is not a North Central term. You know, I shared we've done a lot of this discussions with our work with community initiatives, but I do not know who coined it in the first place. But really, it's looking at different ways to solve multiple problems through different sectors. And so, you know, an example conversation that didn't get selected up north, but was focused on is our issue with childcare and childcare providers in our region. So childcare doesn't just impact, you know, access to care or Head Start or anything like that. That also has an impact on meaningful work and wealth, because if someone can't get access to childcare, they may not be able to have the time to go to college and expand into college, find a job that can provide a comparable livable wage. And so starting to think about, you know, how are we working with childcare providers? How are we working with employers? How are we working with housing providers to start developing a framework where people can live here and live in a meaningful way, right? Like in our region, as I'm assuming across the nation, housing is a major issue as well. And so how do you create affordable housing so that our local businesses can recruit individuals into this region? How do they work in partnership together, not just focusing on housing and recruitment, but how do we start driving livable wages back to our community that then has a broader impact overall?
Thanks so much, John. There's a really important question that Jason shared in the chat. Let's surface this one and then we'll close out. And Erin, I'll invite you to speak to kind of how you all and how we all can be thinking about kind of access to data moving forward as national data sources become potentially unreliable and that data availability is a little bit more tenuous.
Yeah, that's certainly something we're keeping a close eye on. I will say that from our organizational, perspective, one is that we have independently sourced the data that we have presently, so we're not relying on any like live connections to current data. But of course, as time goes on and we're awaiting those data updates, this will be an issue. We do have a large catalog of data. You're only seeing a very small slice of it here so that we are able to kind of pivot and shift. We have a lot of options for different variables that we can move to try to be as flexible as possible. And then just through our work and our experience and relationships, we have options to source data at the local, regional, state level, as well as, strategies to just collect data from qualitative sources and use this as kind of a springboard to ground truth, validate and hear from folks whether this does reflect their lived experiences. And in the meantime, we hope this is just another tool to advocate and express the importance of these data for this kind of work and change. It's definitely something we're watching, though.
Great. Thank you, Erin and Elaine and John, and to everyone for being with us today. I know the chat has gotten very lively, so thank you everyone for chiming in there. We'll make sure that the resources that we share after kind of respond to everybody's questions to the extent that we can. So in closing, just kind of want to, again, take a step back and reiterate a lot of the really important points that John and Elaine surfaced around how this has benefited their work and why we designed the hub in the way that we did, really to help kind of bring that holistic ecosystem view that's rooted in thriving vital conditions and shared stewardship. And that this can really help us to root our work in possibility and aspirations about what we want to create. Really embracing that asset-based orientation versus focusing first or only on, specific problems that we're working to address. And we really think that kind of looking at all of the ingredients that matter, not just longer term outcomes. So the how we get there, the stewardship piece is really, really important to give more visibility to. We're also really, really proud that we're able to center belonging and civic muscle, especially right now, in a way that makes it hopefully more visible, easier to value, and then easier for all of us to work to increase investments in it. And then we're really, really hoping, and John and Elaine spoke to this in terms of how they've used these resources locally, but that all of this can help us to use the insights that we get from the data to really inform our ongoing learning and action. Not just rendering judgments. So really kind of embedding that learning orientation more fully into our work. So we hope that you all will go swim around in the hub a little bit, knowing that it can help to assess progress, build shared understanding, and learn from others, that it is free and evolving. A quick note, we've mentioned, quite a few times that we are planning to kind of beef this up with more investment, and we just wanted to highlight some of the things that we have planned around that. First and foremost, expanding the data that are available around vital conditions and thriving, as well as being able to share more regular data around shared stewardship, and also doing meaning making with local and national practitioners about what all of this means, what the implications are, and sharing those insights widely. So there's information here and also on our website about how you can share feedback. We have a quick survey that is shared in the chat now. We would love to hear how you experienced all of this. There's also some places where you can kind of raise your hand if you'd like to be more involved in the ground floor with us. We would love to hear from you. And also invite you to join our next Toolbox webinar in early September. We'll be sharing more information about that soon. So thank you again for starting your week with us. It was great to be with you all. And thanks again to Elaine and John and to Erin for being our kind of Sherpas for today's call. Take care, everyone.